Let's review the thoracic cage, some of the thoracic contents, and then we'll get into discussing the blood supply for the thoracic cavity. The first few features I wanted to show you about let's get you oriented, I guess, first. So, to give you an idea, what we're facing here is this way is the head, this way being the legs, this way being the legs, sorry. This is our anterior and our posterior, okay? So what we're looking at here, this is actually where the ribs will be coming into the sternum, okay? Again, to further orient yourself, what you see here are muscles, or the muscular diaphragm here. These are fibers from the diaphragm. Above it, this guy here is all the heart, covered in its fibrous pericardium, okay? You can see here where the fibrous pericardium becomes continuous with the central tendon of the diaphragm. Some of the features I'd like to show you. The first one is this guy right here. This guy comes from the intervertebral foramens of cervical spines 3, 4, and 5. This is the phrenic nerve. The phrenic nerve comes down into the thoracic cavity. It passes anterior to the root of the lung. This area right here you can actually see, and if I can point out to you, this here looks like the pulmonary artery, and this looks like one of the pulmonary veins. Okay? The phrenic will come down and transit anterior to the root of the lung. When it does that, it ends up giving motor fibers to the diaphragm itself, and then also gives sensory fibers to the fibrous pericardium, the mediastinal parietal pleura, and the diaphragmatic parietal pleura of the lung. When we put this guy and reflect it back, we're going to look at this nerve here, which actually exits the jugular foramen. It's done many things before you pick it up here in the thoracic cavity. This is the vagus nerve. And on this being the left side, the vagus nerve at the level of the aortic arch, which is right here, gives off the left recurrent laryngeal nerve, which I'm showing you right here. The left recurrent laryngeal nerve will go underneath the aortic arch and go back up to the area just below the vocal cords to give sensory innervation to the area or mucosa below the vocal cords, and give motor innervation to the muscles of the vocal cords themselves. At which point, vagus will continue down, giving exclusively parasympathetic innervation to the heart to decrease heart rate, to the lungs to increase breathing rate, and to the esophagus to increase peristalsis. And keep in mind, when it goes to the lungs, we're talking about bronchial constriction. On the right side, the vagus will loop under and give off, we don't have it on this section, but I'm just reminding you that the right side will give off the right recurrent laryngeal underneath the brachiocephalic trunk. Keep in mind that once vagus goes down, it will be traveling on the left vagus will be traveling on, this guy will be traveling on the anterior surface of the esophagus, whereas the right vagus will be traveling on the posterior surface of the esophagus, and they'll pierce through the diaphragm at T10 and go on to the respective surfaces of the stomach and other organs in the abdomen. Since we just finished talking about the parasympathetic innervation of the vagus, it might make sense to talk about its counterpart, the sympathetic innervation, which is provided by the sympathetic trunk that comes all the way up and gives off ganglia. You can see they're usually very prominent ball-like structures along the posterior surface of the thoracic cage. And the sympathetic trunk will travel along just laterally to the vertebral column, and their ganglia are their distinguishing feature for how you tell it apart from other structures in the thoracic cage. Remember that the sympathetic trunk is responsible for the fight or flight response. So now what I'm going to tell you about let's talk about the arterial supply and venous drainage in the thoracic cage. When we talk about the thoracic blood supply, I'd like to divide it up into 4 different areas. First, you have your anterior, and then you have your posterior. And so they're subdivided then from there as your arterial supply and your venous drainage. So let's first talk about the anterior surface, okay? So coming off and I'm going to give you another section here. So I've taken the breastplate off one of the cadavers, and we're looking at the sternum here, okay? And what happens in the anterior portion of the thorax, at the subclavian artery, will give off the internal thoracic artery. That's this guy right here. The internal thoracic artery will end up going down just laterally to the sternum on either side and give off 2 branches to each of the intercostal spaces 1 through 6. At the level of the xiphoid process, the internal thoracic artery will divide into the musculophrenic artery, which will go along the lower border of the ribs and give 2 anterior intercostal arteries to spaces 7, 8, and 9. As the internal thoracic comes down and splits into the musculophrenic, it also gives off the superior epigastric artery. And the superior epigastric artery is what continues along the inner surface of the anterior abdominal wall to supply that area. The anterior spaces for 10 and 11, intercostal spaces 10 and 11, there is no anterior intercostal arterial supply. Okay? Spaces 10 and 11 have solely their supply come from the posterior arterial supply. As for the venous drainage anteriorly, the internal thoracic vein is completely analogous to the internal thoracic artery. Only the internal thoracic vein arises at the level of the xiphoid process from the musculophrenic vein and the superior epigastric vein, and it will go up and then take in all the tributaries from the anterior intercostal veins, and it will release its blood into its respective brachiocephalic vein. Then if we go to the posterior surface, when we look at the posterior aspect of the thoracic cage, the arterial supply comes from the posterior intercostal arteries, which are given off by the descending aorta. Something special about that part, though, is that the descending aorta will give off the posterior intercostal arteries for spaces 3 through 11. However, for spaces 1 and 2, there will be what is called the superior intercostal artery, and it comes off of the costocervical trunk, which comes off of the subclavian artery. So the spaces for intercostal spaces 3 through 11, the right posterior intercostal arteries have to traverse the vertebral column and then end up running in this space called the subcostal groove of each of the ribs. And what happens at the angle of the rib gives off a collateral branch down that runs along the superior border of the rib below to anastomose with the 2 branches that were given off from the anterior arterial supply by the internal thoracic artery. The venous drainage, what happens with the venous drainage is on the right side you have the azygous vein, which is actually seen right here. And on the left side you see the hemiazygous vein. The azygous vein is responsible for taking in the venous drainage from posterior intercostal veins 5 through 11. The azygous vein originates at the fusion of the subcostal vein and the ascending lumbar vein at the level of T12. So azygous comes all the way up, has the posterior intercostal veins drain into it for spaces 5 and 11. Spaces 2 through 4 if you can see this here, will actually drain into a common vein, which is called the superior intercostal vein. And that drains the areas for spaces 2, 3, and 4. And then that superior intercostal vein is what drains into the azygous vein. The azygous vein will actually drain right into the posterior surface of the superior vena cava. And lastly, there's one space that hasn't been accounted for, and that's the posterior intercostal space for space number 1, and that drains into the right brachiocephalic vein, and then on the left side, the left brachiocephalic vein. To see that nice van relationship that happens in the subcostal groove of the rib, let's look at one of these spaces here. And I'm going to try to zoom in to give you an idea of what that looks like a little bit better. Okay, so this is a very nice relationship, what we're looking at right here. And we see the 3 different items here that run in the van relationship. The most superior being the posterior intercostal vein, then the posterior intercostal artery, and then the posterior intercostal nerve. And the 3 of them run in that van relationship in the subcostal groove of the rib.